Good evening to you and welcome in. I'm Amanda Starantino.
And I'm Mark Mullins. First at 6 o'clock tonight, a good neighbor doing his part in the fight against COVID-19. He teamed up with his wife to make a difference to save lives. And combating the virus has become a community-wide effort. And there's nothing that demonstrates that more than this special story out of Madison County. From WRTV's Stephanie Wade.
We didn't know what was going on in that.
If you live in Anderson, there's a good chance you've spotted these two walking down your street.
So you would go door to door with these signs?
Yes. And
what would you say?
And I would say, hello, I'm Dr. John Woodall, and I'm here to make a house call for just you.
A family practice doctor in Anderson for 49 years, Dr. John Woodall, at 80 years old, is still practicing to this day at Open Door Health Services through Ascension St. Vincent.
Well, that gets back to her. The honey-do list, as long as it's longer than hours at the hospital, I need to keep working.
Both John and his wife, Janet, never got COVID during the pandemic, being extremely careful the past year. So when the vaccine became available, they didn't hesitate.
It is the only thing that you can really do to take care of it. And I wanted to be prepared so that I could continue taking care of patients also.
After realizing some in the community weren't as quick to trust the science, the couple thought it was their mission to change their minds.
Here they come.
Strapping these signs around their neck and going door to door, educating people about the vaccine and why they feel it's so important to get the shot.
And who could say no to these signs?
Who still carries this to church?
Yeah, every Sunday.
You bring this to church?
Every Sunday.
Every Sunday?
Every Sunday.
And if the signs didn't work, his sales pitch is pretty good too.
I'm making a special house
call for you.
At first, people weren't as receptive, they tell me.
It was amazing because when we started out, we were kind of discouraged.
Yeah.
They said, we know about that, and we're not buying any.
But eventually, they opened up, Dr. Woodall answering any questions they had about the vaccine or the science behind it.
Just the mere fact of seeing the doctor that's been in the area made them feel so, well, you know, if you felt like you could come to my door, knock, and ask me to get this shot, I think I'm going to do it.
What drives the duo to want to walk the streets and do this at their age?
The black population is the population that has a high rate of infection. And so we wanted to get out and see what we could do to help at least decrease that.
They fear the variants, like the Delta variant, becoming more common throughout the state, will be trouble for those not protected.
And his being concerned enough to come and talk to them about it made them say, hey, I'm going to do that.
There's still a few people out there that we need to capture, and we're going to keep working on them too.
Stephanie Wade, WRTV.